Hello, everyone. Welcome to a special episode of Unbreaking Science. My name is Dr. James Lyons-Weiler. I'm coming to you live from Pittsburgh, Pennsylvania. Today is 2/24/2020. I know there's a lot going on, but today what I thought I would do is walk the Unbreaking Science community and the public at large through some epidemiologic modeling of coronavirus predictions about where things could go, how bad it could get, using a model, a mathematical model, that allows us to explore some of the assumptions. And the purpose of today's episode is not to come up with an exact prediction about how things are likely to go, but more so to educate the public on the sensitivity of the outcomes of these kinds of things to initial conditions and to how well things work, how parameters interact with each other, and so on. So, of course, I'm not going to recap the entire history of the novel coronavirus that's here, but it certainly is present in over 26 countries. There's case fatality outside of China now. It's not really clear what that ultimate rate will be of the case fatality rate. That's the number of deaths per cases. But in China, we're looking at a significant case fatality rate estimate during the outbreak, which is difficult to really estimate during an outbreak. There are some maximum likelihood methods we're not going to get into, but nevertheless, I want to get right down to it and explore with you some of these parameters. So what I've done is I've set up a spreadsheet, and as I change the inputs on the parameters, the curve itself changes. The way that this is set up is the x-axis is days past patient zero for an outbreak, and the y-axis is the total number of cases. And you can see that's a humongous number of cases. I arbitrarily modeled, 365 days, and I want to say that the goal here is not to reflect any particular country. This is a very abstract model. And so the y-axis, for all intents and purposes, really the only thing that matters is not so much the scale, but the property of the curves for today's exercise. And so if we look at the basic rate of reproduction, that is an intrinsic characteristic of a virus in a particular context, there's a good reference out about what the basic rate of reproduction is and what it is not. It is certainly not a rate. It is when you talk about rates, you have to talk about per unit time. It is the number of patients that an infected individual is likely to also infect. So it's not the number of patients per unit time. It's not the number of patients, number of new patients, over a week or a day or a month. It is simply it makes things very complicated if we start thinking about it in terms of rates. The basic unit of reproduction here that is estimated to be about 2.6 for that. The case fatality rate is expressed as a percentage here, so it's 0.2. As a decimal, it's 0.026. As a percentage, that would be 2.6%. That's a pretty high case fatality rate if you think about it. That's what it looks like in China, and I have expressed a hypothesis about why that may be so in China and why that may not necessarily be so in all places outside of China. For instance, if the population of China is predisposed to high mortality, or some parts of China are predisposed to high mortality because of prior exposure to a spike protein, potentially either through a mass vaccination program that we aren't told about, or through ambient exposure from preparing meats or eating meats, or from just getting coronavirus, SARS, then that means that all the populations around the world that have had prior exposure to coronavirus spike proteins that are similar to, or perhaps ironically different from, the spike protein of the current one, they may be having a hard time with their immune system, because their immune system is adapted to respond to a particular form of a spike protein. And if the current spike protein mimics that, but it is very similar to it, but it is different enough. We may have a situation where the case fatality rate is very high in those regions due to original antigenic sin, where the immune system has actually trained against one type of virus or bacterium or pathogen, and a similar one, it just can't seem to get a grip on it. So I've added in a social isolation variable because we know that governments are performing social isolation. They're either basically cordoning off all major cities in Italy, entire cities, no coming and going in and out of Venice, for instance, in Lombardy. But we also know that the practice of self-isolation, self-quarantine, if you will, is a form of social isolation. And I'm stressing social isolation because that's how human beings see it. The governments might express it, or health officials might see it in terms of self-quarantining. But in reality, it's social isolation where you don't want to come into contact with people or with things that people came into contact with. I'm not trying to scare anybody, but I'm telling everybody that the reality here is that social isolation is something that many of us in many parts of the country, many parts of the world, are experiencing and will have to experience and prepare for. And what does that mean? I'm going to talk a little bit about what that means near the end. Natural recovery, that is the rate of natural recovery per day, the percentage of people that come out of having coronavirus. And that's something that just shows an arbitrary value of 0.3. That reflects the ratio of patients in China that have been reported as recovering. And for those of you who are skeptical of any data out of China, I certainly don't begrudge you of that. And then I also added a successful treatment rate, assuming that there might be a successful treatment. So here we have one or more successful treatments. So here we have the basic reproduction rate of 2.6 and a case fatality rate of 0.26%. And if this is in any way an indication about what's going on, which I don't think it is for the current outbreak, but just bear with me on that point, and a natural recovery that reflects what we think we're seeing in China, it's possible that this virus has been circulating in China for a long time, a lot longer than the first diagnosed case of having SARS. But I don't want to make too much of a big deal out of that, given what happened last time when I speculated in the open about the possible laboratory origin. And the record has been set straight by now. I hope everybody understands. I don't think that it's laboratory origin. I have new data under peer review that shows it's not very likely at all to be a laboratory origin. And I'm happy to see that other people are catching on to that as well. But what I want to do is I want to toggle some of these values, of the basic reproduction rate, to show you what happens. So if we go to, say, 1.8, it doesn't change the overall shape, right? So 1.8, and we go something higher, like 4.6 or whatever, let me find the point here, 4.6. Okay, you can see that the overall shape doesn't change. What's happening is that the magnitude of the eventual burst, when it really gets underway, that's what seems to be changing here. And here, this model doesn't reflect any social isolation maneuvers, it certainly is not a very massively high case fatality rate, which could cause a virus to die out. Thank goodness, right? But if everybody succumbed to the virus, it wouldn't last very long. And we can play with that parameter. I'll show you what that looks like. But the successful treatment rate here is assumed to be 0 as well. But I want to go back to the 2.6 assumption. That 2.6 assumption, and then let's bring in some social isolation and see what happens. And by this I mean people that are being quarantined inside their homes. If 50% of people in an area where it's circulating, whether they have symptoms or not, are self-quarantined, you can see it puts a very little bit of a dent in it. There's a slight delay, not a lot of delay. If we go to 75% social isolation, then we see a major difference in the curve. And that's important. So the difference between 1 out of 2 people social isolating and 3 out of 4 then you see a major difference in the curve. It actually comes down and takes control of things fairly quickly, right? And that's what China's trying to do. That's why China's trying to do it. 0.6 is 60% social isolation. It's not enough. Let's see. Let's play with this parameter. And that's why I think this is a useful exercise. 0.66 is not enough under this model, right? And again, the relevance for reality is certainly up to debate. And there's weird oscillations in these dynamical models because the number of, from day to day, the number of new cases then seeds the number of the next cases. And that's why we see that strange shape of the curve. But the overall, it's 67%. We still haven't turned it down at 67%. How about 68%? 68% leads to something of a steady state where the oscillations get larger and larger of this. Now, people are saying, well, what's that weird initial period there where there's nothing going on? I presume that the epidemic was not detected until the 18th day of the outbreak from patient 0. Okay, so with 68% of the population being quarantined, you get this strange thing where there are people that are getting infected, you get people that pass it on to the next day, and then some of those people are quarantined and some of them aren't, and so on. So you get these strange, unpredictable, I can't predict these from first principles what these are going to happen. And that's very important to understand that because we can't predict from first principles, here's at 69% social isolation, we can't predict what's going to happen over the long run in reality either, based on these parameters. And so people that think that the government don't know what they're doing, well, yeah, they're right, but the government knows that they don't know what they're doing. And that's a very important thing to say, because anything that the government is saying, or any government is saying about this outbreak, or any major deadly outbreak, they're making their best educated guess at the given time, just like I did on the laboratory origin of the virus. So let's go up to at 69% under these models, under this model with these assumptions. You can see that yes, if you do some social isolation, okay, we can shut down the spread. That's why the focus has been social isolation. Keeping people separate and apart from each other is the number one way to shut down the transmission of a virus like this. And it's very important, I would say, that in the United States, in countries around the world, if your government is asking you to, I would call it shelter in place or self-quarantine, that's very important that you do it. And it's not for the greater good. It's for your own damn good. Make sure that you shelter in place to protect yourself from being infected by other people, because you are at risk of becoming infected simply by touching a door handle or using the same bathroom, or that's why I think people should be expected and required, really socially required, to sanitize the shared social spaces that they use. And if you feel sick, by all means, stay home. I think it's wise and sage advice to not go to the hospital where you're going to infect everybody. Or if you're going to go to the hospital, call first and say, where should I go? This social isolation technique is super powerful at turning this down. So let's put social isolation down to 0, because there's a contrast in terms of treatment. I'm not going to change the rate of recovery. I'm just going to say, what happens if we have a virus like this and a treatment that's only 10% effective? Not much. It didn't change much at all. How about one that is 0.2 or 20% effective? Not much at all. How about 0.3% effective? Not much at all. We're still seeing massive outbreak, 40%, not much at all. But there's a slowdown, just like the social isolation. How about 50%? Okay, so yeah, 50% treatment of efficacy, and that's also treatment compliance. And that means that you're actually taking the drug, you're not skipping. And no, I don't work for pharma, and I'm not a pharma shill, and no, I'm not trying to sell you an antiviral drug. I'm just trying to do math here and show you guys what the dynamics of these equations are. 0.7. Oh, wow, the big difference between 0.6 and 0.7. Okay, so look at what's going on with these dynamic systems. At 0.61, it looks like it doesn't prevent it from taking off. At 0.62, we still don't have a takeoff. 0.63, we still have a takeoff. 0.64, still have a takeoff. 0.65, basically what I'm doing is I'm typing in these parameter assumptions, 0.66. Okay, so now it seems like it's slowing things down. And of course, the next question that people are going to ask is, okay, what about treatment and social isolation? Now, here we get this a similar thing with treatment, right, that we saw before, about the same effect of social isolation at 67%, if you recall. And then 68%, we finally see that there's going to be a slowdown, okay, and in terms of the spread. And don't confuse the spread with R sub naught. Treatment doesn't affect the spread. Vaccines don't affect R sub naught. Okay, looking at the and you can look that up. There's a reference I'll publish in the comments of the video that actually report that vaccines cannot be expected to change R sub naught. It's because it deals with infected people, not people who are not infected. So if the vaccine is working, they're not infected, presumably. All right, so social isolation. Let's do social isolation with a mildly effective treatment of 68% efficacy. Or let's say we can only get treatment to 68% of the people. Then social isolation of 0.20%. Okay, then we see a major effect here. All right, we see at just 20% of social isolation, we see that we can shut it down. But look, at the bottom, there seems to be a persistent kind of buzz of new cases, and that's exactly right. This thing can persist a long time under that condition. Well, let's flip that. Let's go to social isolation of 0.68 and go to treatment of 0.2. Okay, similar curve, more buzz. Okay, it looks like there's a little bit larger number of cases that persist over time that way. If we go to a treatment efficacy of 0.3, a better treatment is 0.4. Now that we have social isolation going on too, 0.5. Okay, so for the granola crunchers out there that are saying, I'm going to take my elderberry syrup, I'm going to take high dose vitamin C, I'm going to take iodine and do nasal douches with iodine, I'm going to drink the iodine that Dr. Brownstein recommends, and so on. And all the treatments that you're thinking about taking, if you're adding to the efficacy of the treatment by actually, getting the viremia in body down to the point where it's not transmitted, also participate in social isolation. There's no way out of this without both. We have to have. Let's say we were really draconian. We had 90% social isolation, right, and 50% effective treatment. So in China, they basically have 99% social isolation with no treatment going on. So let's put treatment at 0. Sorry, I just mislabeled something. Let's change that to 0. It looks like they may be able to get this under control with very high social isolation, but it's going to be a struggle. You see the oscillations there? And that's what I think this looks like, that it's getting under control. There's only 1,200 cases, and that's just because of my starting assumptions. And they can vary. It may have been a greater lag before there may have been thousands and thousands beforehand, before we got 18. I'm only assuming 18 days, and at 18 days, we're at about 1,200 cases. So social isolation is very effective, draconian. What about in the United States? What about in Italy? What are they doing the same thing? I don't know. Is Italy actually telling people to shelter in place? If we have really, really super draconian social isolation where everybody's doing it 1.0, of course, it's going to come down to like 0 very quickly. And obviously the best case situation is you have 18 days of transmission, you catch it, you socially isolate everyone, and you have a treatment that's 100% effective. And so that's the ideal. And I'm glad to have had the chance to walk you guys through this. Again, I want to say that this is not a reflection in any way of reality, nor is it in any way a specific prediction about what's going to happen. All right. There's something like 148 countries in the world, and coronavirus will probably make it to all of them. So what can we do right now? We're still in this 2-week period. We still have maybe 2.5 weeks. Experts are saying if it's going to take off, and the difference. What's actually going to happen. I can't tell from this model because I didn't include super spreaders. We know super spreaders actually exist. We know there are people that spread dozens or hundreds of people. We don't know why. We don't know if it's their biology or just their social role in life. Do they tend to, whatever? You can imagine 1,000 scenarios. But the purpose of this exercise is to let everyone know, first and foremost, it's still worth not hugging, not kissing, not shaking hands. Is social isolation to that extent, mild social isolation in public, self-quarantining, if you will, in public, not putting your hands above your shoulders so you don't touch your eyes, ears, nose, and mouth. This is still very important. Dr. John Campbell today also pointed out that in Iran, for instance, where there are many cases and the case fatality rate is surprisingly high there, maybe because of the MERS infection that people suffer, I'm not sure, that predisposed them to death from this particular coronavirus because of prior exposure to a different spike protein. He said that the social act of kissing, social act of greeting by kissing, it needs to stop, and for a short period of time until this goes away. And I think he's exactly right. So we should do the elbow fist bump to say hello in public. Don't share forks and utensils. If you eat out, if you go to a restaurant or if you go to a grocery store, anytime you're in public, gas handle on a garage, gas station, take some wipes with you. They should be bleach based, right? It's an RNA virus, so they should be bleach based, or the virucidal wipes that say they will kill coronavirus. Ideally, these surfaces need to be wetted for about 10 minutes before another person uses them. Corporations and companies should employ staff members whose job it is, and you can rotate this position to take a spray bottle and wipe down all the common areas, really super clean all those touch pads in the grocery store. Have somebody that greets the customers and ask them to take a wipe on the shopping carts and so on. Door handles, light fixtures in the bathroom, all of these things. There's so much. Just imagine the number of places that people touch in public. This is not a time for panic. This is a time to think calmly and coolly about how all of us can pull together and how to shut down, prevent transmission. Don't hand somebody your cell phone. Your cell phone is one of the filthiest, nastiest things you can carry around, okay? Don't, like I said, share utensils and so on. Why? Because what you're doing is you're reducing the probability that that person, is going to hand you back an infected cell phone and so on. These RNA virus, really super important not to put your hands in near your eyes and nose and mouth, and ears. And if you find someone in public doing it, there should be some kind of a social game that we make, like caught you carrying or something. We need some kind of a social viral thing that takes off where you're picking your nose. Don't pick your nose in public. If somebody just is touching their ears, don't pick your nose. There's got to be something that we could do where this will take off, because I'm just one guy. John's just one guy. Other people are trying to get the word out. We have it within our power to shut down through social isolation means the transmission of coronavirus in the United States and Canada and so on. And I really super urge you to get this video into the hands of public health officials, because the one message that I'm going to put in this video that I need all public health officials to understand is that if there is any way that you can get the message out to people who have had SARS in the past or had MERS in the Middle East, they themselves should automatically quarantine right now, not because they're infectious, but because it may be more dangerous to them. That alone could reduce the case fatality rate. Okay, and I'm pleading with you, please send this to your public health officials at any station, state, federal level, it doesn't matter. And understand yourself, if you had SARS, I'm especially worried about the city of Toronto, and I sent a message in the context of another dialogue I'm currently having with CBC News, the CBC Corporation, to really try to get this to the public health officials who need to understand that there's a antigenic difference in this virus compared to SARS, and the people that had SARS before, may be at higher risk of mortality. The factors of increased risk of mortality from coronavirus, and it looks like many people are going to get this coronavirus, are things like smoking. People should stop smoking now. This is a great chance for you to kick the habit if you've been trying. Cardiovascular disease, diabetes, congestive heart failure, people that are already have these conditions. If you're prone to having pneumonia, if you have a past SARS infection, these are the things that people can self-identify and say, wait a minute, I'm at serious risk. And they should put out a list of people of these criteria. If you have 2 or more of these, then you are at really serious risk of mortality if the coronavirus comes to town. So this SARS-CoV-2, as we're all calling it now, is a really super great opportunity to learn from the mistakes that the Chinese made. We have not exactly, but we have about 2.5 weeks. Now, people are writing to me and calling me, and they're saying, should I prep? Should I start, storing food and water and that kind of thing if I have to socially isolate? And I'm sure that most governments are fully capable of getting food and water to most of their inhabitants. We're not looking at a type of virus, I think, where everything shuts down. The utilities and so on will be kept going by people who are manning those shifts. But what I want to say is that there's 2 reasons for you to consider starting to store water in the containers in your home, if not outright buying cases of water. If you're self-quarantined, if you're asked to self-quarantine, it could last for 3 months or 4 months. We don't yet know. And so it would be really super convenient, mostly convenient, for you to have 3 or 4 months supply of water. Not that your tap water is going to be shut off or anything like that. But in terms of food, then, it would also be super convenient for people to pre-purchase and stock ahead and buy some extra dry goods. And I don't mean beans and rice. People in these situations, the first thing they tell you is just to buy a lot of beans and rice. That's not it, because if there's something goes foul with your water, you don't want to waste that water cooking beans and rice. So what you want to do is, buy canned goods, buy cereal bars, protein bars, canned fruits and vegetables, canned meats. Dinty Moore stock's going to go through the roof right now, right? Canned meats, canned stews, and actually buy things that you can eat that you don't have to cook. Just for the sake of the knowing that, okay, I have a supply here. How much should you buy? Well, you've got 3 meals a day, and you can determine for yourself. It's really easy to say if you're going to have 3 meals or 2 meals a day, you should multiply that by the number of people you expect in your self-quarantine home. If you're looking at it for, say, 30 days, 60 days, 90 days, 120 days, it adds up. It certainly does add up. There should not be a rush on materials and supplies at grocery stores. That is the last thing we want at this point in time, although everybody's going to want to get there, so to speak. But remember that you're not just buying this for yourself. You may not be self-quarantined, but the person right next to you, your neighbor might, and they might run out, okay? And so it's time for us as a species to pull together and look after each other. It's time for us to learn what it's like to try to delay this as long as possible. This thing where, 90% of the population has to be quarantined or anything draconian like that. But it's serious. And I would encourage each and every person that sees this video to share the video, share it with your loved ones, but also share it with the people who can confirm or refute the things that I'm saying. This is my perception. These are my perspectives, my analysis, watching SARS fairly closely. SARS-2, I should say, very closely, and analyzing a lot of data about SARS-2. It's really up to us to act responsibly and to not, take advantage of situations. Acting selfishly in these situations is only going to hurt. I understand that the markets are having a hard time understanding what's happening. And like Warren Buffett said, buy low and sell high. So if there's a dip in the market and you're a speculative investor, there's going to be a sweet spot on that curve where getting in, you could probably make some money. A nice cash infusion in global markets right now after a 3 or 4 month lull, that could really stimulate a lot of jobs, and stimulate global economy. I'm not saying it's a good thing that this is happening to us, but there's an upshot to every downside when it comes to modern economics. So, be excellent to each other. Try not to infect other people. As I said before, keep your fluids to yourself, and understand that your governments are trying to figure out the best strategy for you. What they're going to tell you, they have it under control because they don't want you to panic. And I'm going to tell you, be a little bit prepared. Don't panic. And it's essential, absolutely essential that each and every person act as responsibly to themselves and their neighbors as possible. It's the golden rule, right? So treat everybody very well. We have this potential real threat. Certainly, it's very, very real in China. I think China would have really wished that they had 2 weeks to prepare for what they're dealing with. And the more we prepare for it now, the better off we'll be in the long run. You can see from these predictions. And so I would hasten to add that you should watch John Campbell every day. Dr. John Campbell from the UK. Go back to the beginning and watch all of his progression of his understanding about what's going on. He's very confused why the World Health Organization is not calling this a pandemic, and that kind of thing. He's a gentlemanly scholar, and he tells it like it is without invoking panic. And I hope that I've done that today. I want everybody to understand that. A last important point. I want everybody to understand that if you end up in a place where you're self-quarantining and you think, well, I'm going to make it through by rationing from the beginning, that is not the appropriate way to handle this. If you have 2-3 months supply of food and water, let's say, do not ration at the beginning, because if you ration at the beginning, you're just going to make yourself hungry, and that's going to change the way that you think and feel about things. Try to keep yourself in as good spirits as possible, and it's a great time to exercise. You've got 3 or 4 months of nothing doing, not much else. Exercise and get in shape, as long as you have the calories in your house to do that. So don't ration to begin with, because you're really just going to be undergoing unnecessary starvation, so to speak. What you want to do is consider a time point. If I'm told I'm going to have to self-quarantine for 4 months, then we'll start rationing at 3 months or 3.5 months, sometime or 2 months, whatever is right for you. That way you're in control of that particular decision, what fits your household, what fits your needs, so that you then know that up until that point, you're not going to have to start dealing with things like, the side effects of hunger. It affects the way that we think. It affects the way humans cognitively problem solve and how we assess risk. These are very real factors that we should all take into consideration. People are going to say to me, "What have you done to prepare?" And I'm going to say, "I haven't done anything. I'm thinking about filling up a lot of containers in my house with water right now. That I happen to have containers for that. Thinking about going out, maybe buying ahead a little bit each week for the next couple of weeks. I'm really not concerned, because the food distribution systems in the United States can be easily, I think, converted into one where emergency food delivery systems can occur with people who are not infected, and so we can get by without food for longer than we can get by without water. So the primary concern, I think, would be to make sure that you have some backup water in case anything by remote chance happens to the tap water supply, which it shouldn't. There's no reason to expect that it should, but it's worth having some water on hand. So with that, I'm signing off right now. I'll be back in a little while with a guest, Joy Fritz from Untrivial Pursuit. It's an honor to share this with you. It's an honor to be seen by so many of you as an objective scientist, but this really isn't about that. This really isn't about me. You can check us out at WWDNYK on Facebook. We do have a Patreon, patreon.com/WWDNYK. Think about supporting us a little bit every month. I'm just doing due diligence there because the bills come every month. I'm sure they do for you. And Dr. James Lyons-Weiler signing off until I see you next time.